I'm Dr. Sarumathi, professor from the Department of Oral Medicine and Radiology. I have specialized in epidemiology. I'm a clinician and a researcher too. The lecture aims to delve into the components of clinical examination and arriving at a diagnosis. As we all know, oral health is an essential component of overall health and well-being. Oral diseases encompasses a wide variety of conditions affecting the teeth, gums, oral mucosa and its associated structures. Very accurate and timely diagnosis of oral disease is essential for effective treatment, prevention of complications and overall health improvement. A precise history and physical examination and appropriate screening and diagnostic testing are the center of this process for ascertaining an accurate diagnosis and developing a safe and an effective treatment plan. So, this talk will focus on a systematic step-by-step approach to clinical examination and how to arrive at a correct, accurate diagnosis. Before going into the step-by-step approach, let's see what is the significance of clinical examination. First and foremost, it is done to get an accurate diagnosis. Clinical examination helps in identifying signs and symptoms of oral diseases such as ulcer, swelling, lesions and discolorations. At many times, it facilitates the detection of systemic conditions with oral manifestations like the diabetes mellitus, anemia or autoimmune diseases. It also helps in early detection of a serious condition such as oral cancer or oral potentially malignant disorders, which can be identified during clinical examination in the initial stages itself and which helps in improving the prognosis of the disease. Other than that, comprehensive patient assessment is done with the help of clinical examination. A detailed examination includes not just the oral cavity but also extraoral features such as the lymph nodes, temporomandibular joint, etc. that may reveal underlying issues. It provides a holistic view of the patient's overall health considering medical history and the clinical findings. Other than this, an important significant point in clinical examination, it helps in guidance for investigation. Clinical examination often directs the need for further diagnostic investigations such as radiographs, biopsies or blood tests, ensuring a targeted approach. The main pivotal point of clinical examination is to treat the patient. So, the treatment planning depends on a thorough clinical examination. It helps in formulating an appropriate and individualized treatment plan based on the findings. The clinical findings can also influence referrals to other specialties if needed. Other than this, monitoring is very important. Monitoring disease progression through regular clinical examinations are crucial for the progression or resolution of oral conditions, ensuring timely intervention. With the above mentioned significance, it also aids in education and preventive role. During the examination, the clinician can educate the patient on oral hygiene practices and preventive care. It helps in identifying risk factors such as smoking, alcohol, etc. and helps to counsel the patients to mitigate them. So, from this we move on to the step-by-step approach of clinical examination. We start with general physical examination followed by systemic examination and then local examination, which will include your extraoral examination and intraoral examination. General physical examination, this begins the moment a patient steps into the clinic and is first observed. What is the objective of general physical examination? It is to elicit medical condition of the patient and to rule out any possible systemic complication or any emergencies. As the patient enters the clinic, we first observe the gait. Gait is nothing but the manner of walking. Abnormal gait occurs due to various systemic conditions and some types of gait are your waddling gait and your scissors gait. Moving on to build. Broadly built can be divided into well, moderately or poorly built. It can also be classified as ectomorphic, mesomorphic or endomorphic. Nourishment also comes under build. Nourishment can be broadly again divided into well, moderately and poorly nourished. Certain clinical signs in the oral examination will help us to diagnose certain deficiencies of one or more nutrients. Some of the signs of vitamin deficiencies are bald tongue, your bleeding gums, delayed eruption of teeth, etc. We will have to look for the stature of the patient also. Stature is the relationship of arm length to body length. Very tall is considered to be a giant, for example, your Marfan syndrome, and very short is considered to be dwarf, which we see in achondroplasia patients or Down syndrome patients. Coming on to posture, it's very important to record posture also. Different types of abnormal postures are scoliosis, wherein the lateral curvature of spine is seen. Kyphosis, posterior rounding of the thoracic spine is found in such patients. Moving on to skin, we will have to do a thorough examination of the skin. Dermatological lesions can manifest both in oral and skin, called as the mucocutaneous lesions like lichen planus, pemphigus, etc. Skin should be checked for color, texture, if eruptions, any eruptions are seen or any nodules are present. Moving on to the peripheral signs. First comes the pallor. Pallor is the paleness of the skin or oral mucous membrane, either due to diminished circulating red blood cells or diminished blood supply. The sites for checking pallor are your lower palpebral conjunctiva, tongue, palms and nails. Pallor may be caused because of anemia, shock, syncope, postural hypertension, etc. Cyanosis, it is the bluish discoloration due to increased amount of reduced hemoglobin in the capillary blood. The sites where cyanosis are seen are your palate, tongue, tip of the nose, tip of the finger, nail bed, etc. Cyanosis can be peripheral or central. Moving on to icterus, it is a yellowish pigmentation of the skin, sclera and other mucous membrane caused by hyperbilirubinemia, and icterus is seen in the bulbar conjunctiva, skin, oral mucosa, palms and nails. The next we will need to examine for any edema. Edema is a collection of fluid in the interstitial spaces or serous cavities. The fluid may be exudate, transudate or lymph. There are two different types of edema, non-pitting edema and pitting edema. Non-pitting edema is seen in cases of angioneuritic edema, myxedema and lymphedema. Pitting edema is seen in case of cardiac failure patients or liver damaged patients or any kidney failure patients. Clubbing, it is the bulbous enlargement of the soft part of the terminal phalanges with both transverse and longitudinal curving of the nails, which is caused because of pulmonary diseases, cardiac or endocrine diseases. It is very essential to record vital signs. Temperature, pulse rate, respiratory rate and blood pressures are recorded. These vital signs may vary according to the age, BMI, sex and overall health of the patient. The temperature may vary between 97.8 to 99.1 Fahrenheit. Blood pressure may vary between 90 to 60 mm of mercury to 120 to 180 mm of mercury. The pulse rate can vary somewhere between 60 to 100 beats per minute. Similarly, respiratory rate may vary between 12 to 18 breaths per minute. So, till now we saw general physical examination. Now we are moving on into systemic examination. Systemic examination in oral medicine, we don't do thorough systemic examination. Instead, we ask the patient certain questions regarding their various systems. For example, if you're going to record about cardiovascular system, we ask the patient whether he has any history of fainting, palpitation, shortness of breath, tightness of chest, etc. When you're going to question them about respiratory system, we ask them whether they have history of wheezing, coughing, dyspnea on exertion. While asking questions on gastrointestinal and hepatobiliary system, we check about difficulty in swallowing, vomiting of blood, nausea, diarrhea and abdominal pain. In order to assess the CNS or the central nervous system, we ask the patient history of any seizures, frequent headaches, head injury or paralysis. Endocrine system, we ask about any recent weight loss or weight gain, or the patient is hyper or hyperthyroidism All these are some of the questions we asked in order to evaluate their endocrine systems. When we ask about genitourinary system, we inquire whether the patient whether he has frequent micturition or does he have any difficulty or pain during micturition. So, with that we come to the end of systemic examination. Now, moving on into local examination, which is the main component of our clinical examination in oral medicine part. So, this can again broadly be classified into extraoral and intraoral. Under extraoral, we look at the head to check whether it is normal, oligocephalic or brachycephalic, and then we look at the nose to check for any nasal obstruction, discharge or epistasis. Skin, we check for color. Already we seen skin in extraoral examination. We thoroughly check the skin of the body, but here again in the head and neck region we check for any changes in color. Vitiligo or albinism might have hypopigmentation. We check for any inflammation, hemangioma, nevi, psoriasis, caphylate spots, ecchymosis, etc. We also examine for any macules, papules, vesicles or bullae. We look into the eyes to check for the color of the sclera and conjunctiva. We examine the patient for hypertelorism or hypotelorism, propoptosis and exophthalmos. Ears, we check for loss of hearing, tinnitus or any blood in the ear. Blood in the ear can be seen in case of some condylar fractures. We check for competent or incompetent lips, cleft lip or any lip pits. Then comes a very important part of clinical examination, your lymph node examination, which is very crucial in the diagnosis, in diagnosing a patient. Nodes draining area of active infection are usually tender. The overlying skin may be warm and red. We will have to look at the position of the lymph nodes because it will give an idea as to which group of lymph nodes is affected and also will help in the diagnosis. The number also is important because some diseases there is generalized involvement of the lymph nodes, like in case of lymphatic leukemia or your tuberculosis, etc. Palpation of lymph node is a must, and when the lymph node is palpated, we check for the number, local raise in temperature, surface margin and consistency. We also check for fixity to the underlying structure. Usually when it's fixed to the underlying structure, we think of malignant lesions. Moving on to temporomandibular joint examination, we check for any clicking and popping sounds, tenderness or pain. Mouth opening is checked. Maximum incisal mouth opening is around 40 to 45 millimeters. Movements or any deviation of the mandible during opening and closing should also be noted. The range of movement from midline is measured in millimeters, and any pain along with location and severity is also recorded. Although salivary gland examination comes under extraoral and duct and orifice and flow comes under intraoral examination, but all three are interrelated, so we are discussing it together. We check for extraorally, we check for the parotid gland and submandibular gland, and intraorally we check for the ductal orifices and the floor of the mouth for any kind of obstruction or anything pertaining to pathology of the salivary glands. Muscles of mastications must be palpated and recorded. Masseter, temporalis, medial and lateral pterygoid muscles are checked for any kind of pain or tenderness in these muscle region. So, from then extraoral examination, we are moving into intraoral examination, which again can be classified into hard tissue examination and soft tissue examination. Under hard tissue examination, we look for the bone, the maxilla and mandible and the alveolar bone. Then we look into the palate and the teeth. Teeth. So, first we check for the number. We check whether the full complement of teeth are present. Then we look for the color of the teeth. The color may vary. If the patient is a tobacco user, he might have extrinsic stains. If the patient has an intrinsic stains, it may be due to amelogenesis imperfecta or dentinogenesis imperfecta or any hypoplasia caused by dental fluorosis or tetracycline stains. So, color of the teeth also is very important to be noted. We look at the size for micro or macrodontia, shape of the teeth. For example, some may have peg laterals, mulberry molars are seen in syphilis. So, shape of the teeth also is very, very important. We look for missing teeth. Missing teeth may be because of extraction of any of the teeth or congenitally missing teeth. From birth itself, the patient might not have teeth because of various systemic diseases, endocrine diseases, or any syndromes associated with it. Then we check for dental caries, impacted teeth, mobility. Mobility has to be recorded according to Miller's classification of grade 1, 2 or 3, and then we check for any fracture of the teeth. Then we look into the regressive alteration of the teeth, that is the wasting diseases of the teeth such as your attrition, abrasion, abfraction or erosions. Oral cavity is examined for the presence of any root stumps, restorations and any supernumerary teeth. This is with respect to your examination of your teeth. Moving on to soft tissues. Under soft tissue, we will look for gingiva, labial mucosa, buccal mucosa, alveolar mucosa, your tongue, floor of the mouth and oropharynx. In gingiva, we look into the color, size, shape, contour, consistency, surface texture, stippling, position, bleeding on probing. These are the things we have to look for when you are examining the gingiva thoroughly. Examination of the tongue, we look for the size, color, swelling or ulcers, fissures and papilla, which is very, very important, has to be examined. Moving on to buccal mucosa. Buccal mucosa, we check for the color or the pigmented patches, opening of the Stenson's duct, and we also look for buccal frenum and the buccal vestibule. Floor of the mouth, we again examine for any swellings present, red, white patches in the floor of the mouth should be noted, and opening of the submandibular and sublingual ducts has to be examined in the floor of the mouth. Moving on to oropharynx, the uvula, tonsils, pharynx are examined for their color, size and surface. So, with this precise history taking and thorough clinical examination, we come to a provisional diagnosis. It is also known as tentative diagnosis or a working diagnosis. A general diagnosis is based on clinical impression without any lab investigation. This is an initial diagnosis from which further investigations are planned. So, this is provisional diagnosis. Differential diagnosis, they are a list of conditions that resemble the clinical diagnosis but differ from the clinical diagnosis by at least one feature. Sometimes we might not be able to arrive at one provisional diagnosis because the condition may mimic 2 or 3 other diseases. In that case, we can give a differential diagnosis, and after the investigations, we can come to a final diagnosis and then plan the treatment accordingly. So, moving on to investigation, the use of appropriate diagnostic tests are an absolute requirement for ascertaining an accurate diagnosis, which may include hematological investigations, histopathological investigations, serum chemistry investigations or radiographic investigations. But we have to see to that the whatever investigation done is appropriate for the particular disease which we are going to diagnose. Coming on to final diagnosis, it is the diagnosis that is made after required investigations are carried out. The final diagnosis usually identifies the diagnosis for which the patient primarily has come for, with subsidiary diagnosis of concurrent problems. Once the final diagnosis is arrived, a suitable individualized treatment is planned out and treatment is given to the patient based on the final diagnosis. So, along with this, I wish to add on a few requirements as a clinician. So, understand the patient, empathize with them, care should be taken in the tone of the voice of the clinician. We should give the patient sufficient time to elaborate their complaint. Let the patient tell all his griefs and give assurance to the patient about the treatment process. As a clinician, we should refrain from using strong cosmetics, scents, etc. Outlook of the clinician makes an impression. So, it is very, very important that we are neatly attired. Do not use difficult medical terminologies or jargons before the patient. speak in the language in which the patient can understand, and always treat the patient with a smiling face. In conclusion, clinical examination is the cornerstone of oral medicine, enabling accurate diagnosis, effective treatment, and prevention of oral and systemic diseases. With this, we come to the end of the lecture. In a nutshell, let's quickly recap what we saw. We started off with general physical examination, systemic examination, local examination. Under local examination, we saw extraoral examination, intraoral examination. Under intraoral examination, we saw the hard tissue and soft tissue examination. Based on the precise history, your thorough clinical examination, we arrive at a provisional diagnosis, followed by investigation. Based on the provisional diagnosis, we come to a final diagnosis, and based on the final diagnosis, we finally give an individualized treatment plan. That's all for today's lecture. Meet you all in another interesting lecture. Thank you so much.